clinical competence. You will complete a series of timed activities in a circuit. Each station has a trained examiner who assesses the student's performance against a scoring sheet. OSCE stations could include actors or mannequins. Students move from one OSCE station to the next under guidance from staff members. They are all time limited and there is usually a timer or buzzer that signals the start and end of each session. Usually, each station has allocated time for the students to read the station instructions and don any required PPE. It is also conducted under examination conditions. There are 10 stations in OSCE. 4 are linked around a scenario and based on APIE. A further 4 test skills, and 2 assess the candidate's values, behaviors, and evidence-based practice. There are quite a few skills you could be tested on, and these are pick of inhaled medication, catheter specimen of urine collection, fluid balance chart, in-hospital resuscitation without a defibrillator, intramuscular injection, midstream sample of urine and urinalysis, peak expiration flow rate, removal of urinary catheter, subcutaneous injection, pediatric basic life support, calculating drug dosages, medication administration, physiological observations, safe disposal of sharps, and wound care. When working in healthcare in the UK, it is important to always follow the code. There is a more in-depth explanatory document in Moodle, but we will go through the basics in this video. There are 4 principles of the NMC's Code for Professional Standards of Practice and Behavior, the first being to prioritize people. You put the interests of people using or needing nursing or midwifery services first. You make their care and safety your main concern and make sure that their dignity is preserved and their needs are recognized, assessed and responded to. You make sure that those receiving care are treated with respect, that their rights are upheld and that any discriminatory attitudes and behaviors towards those receiving care are challenged. The second principle is to practice effectively. You put the interests of people using or needing nursing or midwifery services first. You make their care and safety your main concern and make sure that their dignity is preserved and their needs are recognized, assessed and responded to. You make sure that those receiving care are treated with respect, that their rights are upheld and that any discriminatory attitudes and behaviors towards those receiving care are challenged. The third principle of the code is to preserve safety. You make sure that patient and public safety is not affected. You work within the limits of your competence, exercising your professional duty of candor and raising concerns immediately whenever you come across situations that put patients or public safety at risk. You take necessary action to deal with any concerns where appropriate. Finally, promote professionalism and trust. You uphold the reputation of your profession at all times. You should display a personal commitment to the standards of practice and behavior set out in the code. You should be a model of integrity and leadership for others to aspire to. This should lead to trust and confidence in the professions from patients, people receiving care, other health and care professionals and the public. Communication is central to nursing practice and is assessed continually. We assess the full range of communication skills, verbal, nonverbal and written, by observing the interaction between the candidate and simulated patient and also by assessing the nursing documentation in each station. Some examples of communication skills assessed are clearly explaining care, diagnosis, investigations, and/or treatments. Involving the patient in decision-making. Communicating with relatives and healthcare professionals. Seeking and obtaining informed consent. Active listening. Dealing appropriately with an anxious person or anxious relatives. Providing clear instructions on discharge. Providing advice on lifestyle, health promotion, or risk factors. Demonstrating compassion and care during communication. Clear documentation that meets the requirements of NMC 2018, the Code. Professional behavior. Professional attitude. Keeping these in mind, there are some steps to follow.